Hi, so the topic I'm going to be talking about today is Parkinson's disease. What is Parkinson's disease? Parkinson's disease is a type of movement disorder that can affect the ability to perform common daily activities. It is a chronic and progressive disease, meaning that the symptoms become worse over time. Some symptoms include tremors, muscle stiffness, difficult range of motion, difficulty speaking, amnesia, and loss of smell. The disease causes cell loss that occurs in a very specific region of the brain called the substantia nigra. The cells or neurons in this region produce a specific type of neurotransmitter called dopamine. Dopamine helps to regulate movement. The cause is currently unknown as well as the cure for it. There are an estimated 1 million people in the US living with Parkinson's disease and more than 10 million people worldwide with it. Most people who develop the symptoms of Parkinson's disease do so sometime after the age of 50. But Parkinson's disease can affect younger people as well. Approximately 10% of Parkinson's diagnoses occur before the age 50. So, what does it look like if a patient comes in with Parkinson's disease, and what do you do? So, for example, a 62-year-old Caucasian male is in the office today with his wife, after being referred to a neurologist by his primary care physician. The patient reports of having a resting tremor in his right hand and some stiffness in the right arm. His speech seems to be slurred, soft, and slow. His appearance is thin and frail. He stated that he's had some trouble walking in the form of difficulty in initiation, and once he starts walking, he stoops forward with a small and fast steps. However, he freezes during turning and has a tendency to fall forward. The patient started to notice his tremor in the right hand a couple months ago while he was trying to read the newspaper and couldn't keep it still. As he's asked questions about when he noticed the symptoms, he seemed to have a very hard time trying to remember. The patient also explained he has lost the sense of smell. His most recent medical history was a concussion due to a car accident that occurred over 5 years ago. He has no past history of hypertension, diabetes, cancer, asthma, psychiatry problems. He rarely ever exercises and he tries to maintain a relatively healthy diet. He never smokes or consumes alcohol. His initial vital signs were blood pressure 140/74, heart rate was 62 beats per minute, respiratory rate was 16 breaths per minute, temperature was 37 degrees Celsius, and oxygen saturation was on 100% on room air. His range of motion and strength were tested. As you can see, his right side had a lot less range of motion and his strength was a lot weaker as well. His current medications are vitamin D, vitamin B12, calcium, acetylcarnitine, antihistamine, aspirin, potassium, and a multivitamin. The patient's blood pressure, heart rate, respiratory rate, temperature, and oxygen saturation all appeared to be normal. The first major issue was his range of motion. There was a decreased range of motion, limited shoulder flexion, and elbow extension, but no contractures were noted. Next was a decrease in the strength of the upper limb, specifically at the top of the shoulder, and there was a slight weakness of the elbow, hip, and knee. Fatigue was noted with sustained contractions. Along with the loss of motion and strength, there were a few other major concerns about his initial state. These concerns included slurred speech, appearance of thin and stiff, memory loss, loss of smell, and the tremor in his right arm. This leads to the conclusion that he has Parkinson's disease. Many cases of Parkinson's disease are linked to previous brain injuries as well. This may be the case with his past medical history of the concussion from the car accident. Although there is no cure for Parkinson's disease yet, there are medications to help manage the symptoms. Medications can help with walking, moving, and tremors. People with Parkinson's disease have low brain dopamine concentrations. The medications are used to increase or substitute for dopamine. One of the most effective medications is carbidopa with levodopa. It's a natural chemical that passes into the brain and is converted to dopamine. The levodopa is combined with carbidopa which protects the levodopa from early conversion to dopamine outside of the brain. This prevents many of the side effects from levodopa. This medication eventually isn't as effective as it once was. There is also a surgical option to help with the side effects. The surgery is called deep brain stimulation. In the surgery, electrodes are inserted into a targeted area of the brain using an MRI to record the brain cell activity during the procedure. A second procedure is performed to implant a IPG, an impulse-generated battery. Like a pacemaker, the IPG is placed under the collarbone or in the abdomen. The IPG provides an electrical impulse to a part of the brain involved in motor function. Then the patient will be given a controller to turn the device on or off. It will help a lot with the resting tremor and is a good alternative to the medication. It's also recommended to do some daily aerobic exercise. It will help relieve some of the muscle stiffness and improve range of motion and strength. Some examples would be like biking, running, tai chi, yoga, Pilates, dance, and weight training. Sadly, there is still no treatment for Parkinson's disease. The only thing we can do is make the symptoms less impactful and to help the patient enjoy their life. Thank you for listening to my presentation.